If you live with diabetes and struggle with nerve pain, you've probably tried one of those pain creams you can grab right off the pharmacy shelf. They promise quick relief, no prescription needed. But here's the truth. Some of these creams come with hidden dangers that could actually make your condition worse. Today, we're counting down the 5 biggest risks of over-the-counter pain creams for diabetic neuropathy and what you can do instead. Let's start our countdown at number 8, misleading marketing and false claims. One of the most overlooked dangers isn't physical, it's financial and emotional. Many OTC creams are marketed with bold claims, clinically proven to cure neuropathy, or instant permanent relief. The truth? There is currently no cure for diabetic neuropathy. The American Diabetes Association makes it clear. Neuropathy can be managed, but it cannot be reversed with a cream or supplement. This type of marketing gives people false hope and can distract them from proven approaches like blood sugar management, foot care, and prescribed medications. Worse, it can lead people to spend hundreds of dollars chasing products that simply don't deliver. At number 7, overuse and accidental toxicity. Because these creams are sold over the counter, many people assume more is better. But applying too much, too often, or over large areas of skin can actually allow the active ingredient to seep into the bloodstream. Lidocaine, for example, is generally safe in small amounts, but if overused, it can cause dizziness, irregular heartbeat, or even seizures. The FDA has also reported cases of serious side effects, including fainting, when large amounts of topical pain relievers were applied under occlusive dressings or heat packs. Older adults, who often have thinner skin, memory issues, or already take multiple prescriptions, are particularly vulnerable. So what looks like a simple cream can actually create systemic side effects if used incorrectly. Number 6, delayed wound healing. One of the biggest challenges in diabetes is that wounds heal more slowly. Reduced blood flow, nerve damage, and high blood sugar all make it harder for the body to repair itself. Now, add a strong topical cream into the mix, especially ones with capsaicin or salicylates, and you've got a recipe for trouble. These creams can cause redness, blistering, or even open sores. For someone without diabetes, that might just be irritating. But for someone with neuropathy, it could mean an infection that lingers for weeks. Research in Diabetes and Metabolism Research and Reviews shows that patients with neuropathy already face impaired healing, and any added skin damage makes things worse. In other words, the wrong cream can turn a minor skin reaction into a long-term wound that's difficult to manage. Number 5, skin burns and irritation. Many creams for nerve pain contain capsaicin, the compound that gives chili peppers their heat. In small amounts, capsaicin can reduce pain by desensitizing nerves, but it's also notorious for causing severe burning sensations on the skin. In fact, the U.S. Food and Drug Administration has reported cases where people developed second- and third-degree burns from overusing topical pain products with high concentrations of menthol, methyl salicylate, or capsaicin. For people with diabetes, the danger is even greater. Neuropathy reduces sensation in the feet and legs, so burns or blisters may go unnoticed until they become infected. This is not a rare complication. Case reports in medical journals document patients with diabetic neuropathy suffering delayed wound healing after topical capsaicin use. So while a cream might seem harmless, in the wrong context it can literally create wounds that are harder to heal. Number 4, allergic reactions. Another overlooked danger is allergic skin reactions. Many topical pain relievers use menthol, camphor, or salicylates as active ingredients. The American Academy of Dermatology notes that these compounds can cause contact dermatitis, resulting in itching, swelling, or rashes, especially in people with sensitive skin. For those with aspirin sensitivity, products containing methyl salicylate can trigger systemic reactions, including wheezing or difficulty breathing. For a person with diabetes, this is particularly risky because the skin is already more prone to breakdown and slower to heal. What starts as a small rash can progress to open sores or infections. Number 3, masking serious nerve damage. Perhaps the most dangerous risk is that pain creams mask symptoms without treating the underlying neuropathy. According to the CDC, about 50% of people with diabetes will eventually develop neuropathy. The problem is that temporary pain relief can give patients a false sense of security, making them less likely to seek medical attention. There are well-documented cases where patients relied on OTC products for months, while neuropathy silently worsened, leading to ulcers and even amputations. By the time professional care was sought, the damage was irreversible. Pain creams should never replace foot exams, blood sugar control, or medical evaluation. Ignoring progression can have lifelong consequences. Number 2. Drug interactions. Not all topical medications stay on the surface. Ingredients like lidocaine can be absorbed into the bloodstream, especially when applied over large areas or broken skin. The Mayo Clinic warns that systemic absorption of lidocaine may cause dizziness, irregular heartbeat, or even seizures in rare cases. For people with diabetes who are often on multiple medications, including drugs for heart disease, high blood pressure, or seizures, the risk of interactions is higher. Polypharmacy is common. The CDC reports that more than 40% of adults over age 65 take 5 or more prescription drugs. Adding a topical anesthetic on top of that without a doctor's guidance can be a recipe for complications. Number 1. False sense of security. The biggest danger isn't burns or rashes. It's the belief that a cream alone is enough to manage diabetic neuropathy. These products may dull pain for a few hours, but they don't stop nerve damage or prevent complications. The American Diabetes Association emphasizes that the cornerstone of neuropathy management remains blood sugar control, lifestyle changes, and, when needed, prescription medications. Over-reliance on creams may delay these interventions. In the long run, this false sense of security can mean worsening nerve damage, greater pain, and higher risk of infections and amputations. So, are over-the-counter pain creams always bad? Not necessarily. They can offer temporary relief for mild nerve pain. But for people with diabetic neuropathy, they should be used with caution and never as a substitute for real treatment. The best defense against neuropathy will always be blood sugar control, regular checkups, and working with your healthcare team to find safe, effective options. If you found this video helpful, please give it a like, subscribe, and share it with someone who may be struggling with diabetes pain. You can also support our channel by checking out our merch or using the Super Thanks button below. And if you want to learn about natural remedies that may actually help with diabetic nerve pain, don't miss our video right here. Stay strong, stay informed, and take care of yourself.